Plaque is not your friend. Plaque, an insidious adversary lurking within the arteries, poses a grave threat to cardiovascular health and overall well-being. While often overlooked or underestimated, plaque plays a central role in the development of heart disease, stroke, and other life-threatening conditions. In this video, we drill into the nature of plaque, its detrimental effects on the body, and the critical importance of preventing and managing its accumulation for long-term health and vitality. Definition of plaque. Plaque refers to a buildup of fatty deposits, cholesterol, calcium, and other substances within the walls of arteries. It forms as a result of atherosclerosis, a chronic inflammatory condition characterized by the narrowing and hardening of arteries. Formation process. Plaque formation begins with damage to the endothelial lining of arteries, often caused by factors such as high blood pressure, smoking, diabetes, and elevated cholesterol levels. In response to endothelial injury, inflammatory cells, cholesterol, and other substances accumulate at the site of damage, forming plaques over time. There are two main types of plaque: soft, vulnerable plaques, and hard, stable plaques. Soft plaques are more prone to rupture and can trigger blood clots, leading to sudden blockages and potentially life-threatening events such as heart attacks or strokes. The adverse effects of plaque. Arterial narrowing. As plaque accumulates within arterial walls, it gradually narrows the arteries, restricting blood flow to vital organs and tissues. Narrowing of coronary arteries can lead to angina, chest pain, or myocardial infarction, heart attack, while narrowing of cerebral arteries can cause transient ischemic attacks, mini-strokes, or strokes. Blood clot formation. Plaque rupture exposes the underlying tissue to circulating blood, triggering the formation of blood clots, thrombi. Blood clots can partially or completely occlude arteries, leading to acute cardiovascular events such as heart attacks, strokes, or peripheral artery disease. Impaired organ function. Reduced blood flow and oxygen delivery to vital organs and tissues due to plaque-related arterial narrowing can impair organ function and contribute to a range of health problems. For example, reduced blood flow to the heart may result in myocardial ischemia or heart failure, while reduced blood flow to the brain may cause cognitive impairment or dementia. Systemic inflammation. Plaque formation is associated with chronic inflammation within the arterial walls, perpetuating a vicious cycle of endothelial damage, plaque progression, and inflammation. Systemic inflammation increases the risk of cardiovascular events and contributes to the development of other inflammatory conditions such as arthritis, autoimmune diseases, and metabolic syndrome. Risk factors for plaque formation. Unhealthy diet. Diets high in saturated fats, trans fats, cholesterol, and processed foods promote plaque formation and atherosclerosis. Excessive intake of sugar, refined carbohydrates, and sodium can also contribute to endothelial dysfunction and inflammation, exacerbating plaque accumulation. Physical inactivity. Sedentary lifestyles and lack of regular exercise are associated with obesity, insulin resistance, dyslipidemia, and other risk factors for plaque formation and cardiovascular disease. Physical activity promotes cardiovascular health by improving blood circulation, reducing inflammation, and enhancing endothelial function. Smoking and tobacco use. Tobacco smoke contains numerous toxic chemicals that damage the endothelium, promote inflammation, and accelerate plaque formation. Smoking cessation is one of the most effective ways to reduce the risk of plaque-related cardiovascular events and improve overall health. Hypertension. High blood pressure increases the mechanical stress on arterial walls, promoting endothelial injury, plaque formation, and arterial stiffness. Controlling hypertension through lifestyle modifications and antihypertensive medications is essential for preventing plaque-related complications. Diabetes and insulin resistance. Diabetes and insulin resistance are major risk factors for atherosclerosis and plaque formation, as elevated blood sugar levels can damage blood vessels and promote inflammation. Tight glycemic control, along with lifestyle modifications and appropriate medication therapy, is crucial for managing diabetes and reducing the risk of cardiovascular complications. Prevention and management strategies. Healthy lifestyle habits. Adopting a heart-healthy diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can help prevent plaque formation and promote cardiovascular health. Engaging in regular physical activity, maintaining a healthy weight, managing stress, and avoiding tobacco use are also essential components of a preventive lifestyle. Medication therapy. Medications such as statins, antihypertensives, antiplatelet agents, and anticoagulants may be prescribed to reduce cholesterol levels, lower blood pressure, prevent blood clot formation, and manage other risk factors for plaque-related complications. Adherence to prescribed medications and regular follow-up with healthcare providers are essential for optimizing treatment outcomes and reducing the risk of cardiovascular events. Screening and monitoring. Routine screening tests such as lipid profiles, blood pressure measurements, and blood glucose monitoring can help identify risk factors for plaque formation and cardiovascular disease. Imaging studies such as coronary artery calcium scoring, carotid ultrasound, and coronary angiography may be used to assess plaque burden and guide treatment decisions in high-risk individuals. Risk factor modification. Targeting modifiable risk factors such as hypertension, dyslipidemia, diabetes, obesity, and smoking through lifestyle modifications and pharmacological interventions is key to preventing plaque formation and reducing the risk of cardiovascular events. Comprehensive cardiovascular risk assessment and individualized treatment plans tailored to each patient's unique risk profile are essential for optimizing preventive strategies and improving long-term outcomes. Plaque, though silent and insidious, is a formidable foe in the battle for cardiovascular health and longevity. Its relentless progression can lead to devastating consequences, including heart attacks, strokes, and premature death. However, armed with knowledge, awareness, and proactive measures, individuals can take control of their cardiovascular destiny and minimize the impact of plaque on their health and well-being. By adopting a heart-healthy lifestyle, managing risk factors, and seeking timely medical intervention, we can turn the tide against plaque and pave the way for a healthier, more vibrant future. Plaque is not our friend, but with diligence and determination, we can outsmart this silent enemy and reclaim our cardiovascular health with renewed vigor and vitality. If you received value from this video, please like and subscribe to the channel.